Did you know that IBS is more common in women? And did you know that IBS does not predispose you to things like colorectal cancer?
Hi, this is Dr. Jonathan Youssef, Networking for Your Optimal Health. Today's topic is going to be about IBS, and today with me is Salam from South University. She's here to present a little bit about IBS, and this is sometimes information that I want to share with my patients to help them understand their condition. And IBS stands for?
Irritable bowel syndrome.
Can you go ahead and let us know what your topic is going to be about and what you'd like to share with some of the audience and patients?
Yes, so I'm going to be talking about the symptoms of IBS, how we can differentiate it from things like inflammatory disorders like Crohn's and ulcerative colitis, about possible triggers, possible treatments, and possible causes of IBS, and different supplements that you can take to try to kind of help yourself out.
What are some of the signs and symptoms of IBS?
Okay, so we see a lot of gas, bloating, diarrhea, constipation, mucus in the stools, abdominal pain, cramping, nausea, decreased energy.
So if somebody comes in, how do they know that this is not something more serious? Is there any distinguishing symptoms for IBS?
So in order to differentiate it, you want to make sure that you don't have systemic symptoms. So things like fevers, things like rashes, weight loss. Do you wake up in the morning to rush to go to the bathroom? Things like that.
So if I've had abdominal pain, diarrhea or constipation, or just irritability in my abdomen or stomach, is that IBS?
Not necessarily all the time. We can do certain tests, like we can do a colonoscopy to ensure there's no inflammation and things like that.
Is there a time period when I should be concerned that it's IBS and not something more serious?
So IBS is more, it's chronic, and we usually like to see that the symptoms happen 3 times in a month for 3 consecutive months in order to diagnose it.
How do you diagnose IBS?
Usually it's a diagnosis of exclusion, so we're going to do like colonoscopies to make sure there's no inflammation, endoscopies, we're going to do celiac testing to make sure it's not a gluten intolerance, we're going to check for lactose intolerance, things like that.
Question, why did you pick this topic? Did you have any specific reasons?
I see it a lot, especially in my classmates in school. A lot of people were complaining of just like constant like abdominal pain and diarrhea, especially around like exam time and stuff like that. So it kind of prompted me to look more into it.
Are there any associated diagnoses with it? In other words, I know that some people mentioned that there's possibly a mental health component to that.
Yeah, so a lot of people have anxiety or depression that do also have IBS, because we do see that it's that certain things like TCAs or SSRIs that are used for anxiety and depression can actually aid in it.
TCAs?
Tricyclic antidepressants.
And what was the other one you mentioned?
SSRIs. So those are your like serotonin reuptake inhibitors.
Oh, what are those?
Those are medications that we use for patients who have depression or anxiety.
Great. So they think that there's a link between depression and anxiety and IBS?
Yes, because a lot of the times the symptoms are much worse when a patient is anxious or when they're going through depression. Like I was saying before, a lot of the times I would see it in my classmates during exam time when, people were very anxious. They were more prone to getting things like their diarrhea and stuff like that.
What are the other triggers?
So food, actually. Although there's not an exact science that says that certain foods cause IBS, certain foods like foods that contain wheat, foods that contain dairy products, citrus fruits, coffee is a really big one, milk, cabbage, beans, carbonated drinks, all of that has a really big predisposition for it.
How do you determine if IBS, is there diarrhea or constipation or both? What kind of distinguishes it between and what's more common, diarrhea or constipation?
So you can have diarrhea solely, or you can have constipation, or a mixture of both. We see that it's more common to have the diarrhea based. We also see it more common, like I said, in women. They're twice as likely to actually have it because hormones play a big role in it. So a lot of women, when they're like around the time of their menstrual cycle, they see that their symptoms are much worse, whether that's the diarrhea, the constipation, or the mixed.
What kind of diet is the best diet for IBS?
So there's a bunch of things actually to do for IBS. For the diet, you want to eliminate any inflammatory foods. So those are things like your dairy products. Those are things like your gluten products. There's even a FODMAP diet, and you're eliminating lactose, fructose, fructans, galactans, and polyols. And those seem to cause symptoms like gas, bloating, and swelling. So those are the foods that you'd stay away from.
Is sugar a trigger?
Yes, sugar is a trigger, especially like synthetic sugars, like the additive sugars that you'd add to a lot of things.
Is there foods that you recommend to eat?
There are certain supplements, so anti-inflammatory, so turmeric. There's also probiotics. There's also things like berries, so your blueberries, raspberries, and strawberries, fruits that are lower in sugar.
Are there any specific supplements that you recommend?
Yes. Like I was saying, I would recommend turmeric. Whenever you're buying that, though, make sure it contains black pepper because it helps with the absorption. Probiotics, like there's one certain probiotic called orthobiotic that is specifically very good for the treatment. It contains 7 different probiotic strains, which is really important. And it actually also has third-party testing, which ensures that their product is clean. And they not only look at the manufacturing date, they also look at the expiration date to make sure that the product is good all the way throughout its expiration date.
I've seen different turmeric formulations, and the turmeric that is important to note is that you can add black pepper, which is an absorption, but there's also some now that I've seen using healthy fatty acids like medium chain triglycerides to help absorb, and there's a couple of products over the counter as well. I do agree with you, the orthobiotics is excellent. It's made from a company called Orthomolecular. It does have third-party testing so that it does ensure that the quantities in there are accurate, and it has a fungal as well component, which is called the Saccharomyces, which helps to also add to the the gut flora to improve the gut health. And so the reason why I do choose probiotics to help with patients with IBS is that those good bacteria help to absorb the good nutrients into the bloodstream, but it also helps to block the bad nutrients and the toxins from getting picked up.
It also contains something called BioShield, and what this does is it protects the probiotic from the acidity in the stomach until the probiotic gets to where it needs to get to. So it's pretty good with that. Also, another thing that I wanted to add is that stress reduction is really, really important. So things like yoga, meditation, acupuncture have all been very helpful. Exercising, because it helps lower your cortisol levels, and getting plenty of sleep. And specifically with diarrhea-based IBS, they say that eating smaller meals throughout the day will lessen the symptoms of the diarrhea and help with absorption of the food better.
Excellent. What are your thoughts about treatment?
So with treatment, there's a lot of different things that you can do. Like we talked about, you can do the just the elimination of those foods. You can do the stress management. You can take the supplements, exercise, getting plenty of sleep, and then we can also do certain medications. So for an example, if it's the diarrhea-based one, we can do things like loperamide, and that can help control the diarrhea. We can do anticholinergic medications like Bentyl, and this can help relieve very painful bowel spasms. And these are more typically used, of course, for people with a diarrhea base. TCAs, like I talked about, the antidepressants and the SSRIs are also used, and that does seem to help patients. There are other medications like Lotrinox, Vibirza, and rifaximin, and these also help with the diarrhea-based IBS. But those are usually second line. First line, we try to manage the stress in the foods and things like that.
I'd like to add that some of those products you mentioned did not have FDA approval, so using things like the anticholinergics or the Bentyl may be very helpful for patients, but unfortunately we only have a handful of FDA-approved drugs for the treatment of IBS, and there's the IBS-D, which is the diarrhea, the IBS-C, which is the constipation, and the IBS-M, which is the mixed. So you have the two. And right now, maybe you can share with us which ones are the FDA approvals for which one product. Are you familiar with that one? So I think Amitiza, for example, is another product that we use for IBS, and it is for the IBS with constipation. Linzess is also approved for IBS with constipation. They use different mechanisms of action. For example, like Linzess uses a cyclic AMP mechanism that works on the gut to help with the absorption of fluids and helps with the constipation. But also, this nullifies or binds to receptors, the pain receptors in the gut. You have, on the opposite end of the spectrum, diarrhea. So the IBS with D has a prescription medication called Viberzi. And Viberzi is a medication that's an opioid receptor blocker. Yes, I agree. I know that it's not the opioid family. It is a controlled substance, but it actually just binds to the opioid receptors on the receptors in the gut. So you have a third medication. This is called Xifaxan. Xifaxan is a antibiotic, and antibiotics have a different role altogether. As we talked about, there's good and bacteria in the gut, there's good and bad bacteria in the gut. While we use probiotics to help with the replenishment of the good bacteria, Xifaxan is a prescription antibiotic that helps to kill off the bad bacteria in the gut to help the absorption of your nutrients better. Those are all actual FDA-approved medication. The alternative medications, are not FDA approved, but they are used and they're very cost effective compared to the maybe a little more costly FDA approved drugs. So it's not that you can't use them as a physician or a provider, but perhaps you could look at different options and what are successful for patients. So what are some natural treatments in addition to the turmeric and the probiotics?
We can also do peppermint. A lot of people find that chewing gum, even that just contains peppermint, helps. Peppermint is a natural antispasmodic, so it will relax the smooth muscles in the intestines, and it will provide short-term relief. So that's something that people tend to use.
And then I saw that there's some stress reduction.
Yes. Stress reduction is very important for IBS. So like I said, things like maybe seeing a counselor, acupuncture can be used, yoga, meditation, whatever it may be, having that support system, having someone to talk to can be very beneficial.
There is a last supplement that we were talking about earlier. I think the bovine immunoglobulin. So that's basically, and I'm not going to get gross with this, but it's the cow, and so their intestine contains a lot of good nutrients and immunoglobulins. Immunoglobulins are your body's immune system, but the gut in a healthy cow has excellent amount of immunoglobulins, which help to, again, improve the gut health for our own. So it comes in a powder form. There's a prescription actually called Interrogam, but there is actually a supplement that's very similar to it, and it's basically bovine immunoglobulin. Brand treatment or sort of off the beaten path mechanism in which to improve. And I have seen improvement significantly with this product, including some helpful benefits for people who have a bacteria called C. difficile as well. So with probiotics and Interrogam, you might find yourself doing some very natural ways to improve your symptoms. So I know there was some other discussions that you wanted to, we think that there might be some mechanism of action of how IBS comes about.
Yeah, so we're not really sure, but there's different causes that they've talked about. One of them being muscle contractions in the intestine. So the walls of your intestines are lined with layers of muscles, and they contract as the food moves through. So contractions that are going to be stronger and last longer will cause things like your gas, bloating, and diarrhea. And obviously your weaker contractions will cause like slower food passage and will cause the constipation. Also nervous system, so abnormalities in the nerves in your digestive system can cause you to experience more discomfort when your abdomen stretches from gas or stool. Inflammation in the intestines, so some people with IBS actually have an increased number of immune system cells in their intestines, and this is associated with pain and with the diarrhea. Infections are also a really big thing. So IBS can actually develop after a very severe bout of diarrhea, so gastroenteritis, which can be caused by a bacteria or a virus. So the IBS can be associated with a surplus of bacteria. Just changes in the bacteria in the gut. So microflora are the good bacteria that reside in the intestines, and they play a key role in your health. And research shows that microflora in people with IBS might differ from the microflora in healthy people.
And have you heard of the condition SIBO? It's
yes,
the
small intestinal.
Small intestinal bacterial overgrowth, and there's some suspicion that there's some possible theory that the overgrowth of this bad bacteria, basically, could be contributing factor in IBS.
Yes.
Yeah. So I agree. I think it's what we mentioned with the bacteria in the gut. Well, I mean, I think that there was a lot of information there. We can take that back to and find out more information about IBS, but would you add anything? How does a gastroenterology consultation play into consideration? Should we do imaging, or do we just take the symptoms and then just work with them?
I think it just depends. When a patient presents like this at the beginning, of course, we're going to do just the typical test that I talked about to ensure that it's nothing else. So we'll do like a stool sample to make sure that it's not, a parasite or anything like that. We can do an H. pylori test, get all of those out of the way. And then if the patient continues to experience things like the diarrhea and things like that, then we can move on to a colonoscopy to just ensure it's not an inflammatory bowel condition. So it's usually more of a diagnosis of exclusion. Most of these patients end up seeing a GI just because their symptoms can get pretty bad, just to make sure that it's nothing serious.
Excellent. Well, thank you. I appreciate you coming out to talk about IBS, and I think we got a lot of good information, and we're looking forward to another great topic. This is Dr. Jonathan Youssef, Networking for Your Optimal Health. Thank you.
Thank you.